Are diclofenac and naproxen the same? No, diclofenac and naproxen are not the same. While both are nonsteroidal anti-inflammatory drugs, NSAIDs, commonly used to treat pain and inflammation, there are some key differences between the two. Diclofenac and naproxen belong to different classes of NSAIDs. Diclofenac is a phenylacetic acid derivative, whereas naproxen is a propionic acid derivative. This means that they have different chemical structures and mechanisms of action in the body. In terms of potency, diclofenac is generally considered to be stronger than naproxen. It is often prescribed for more severe pain or inflammation, such as in cases of rheumatoid arthritis or post-operative pain. Naproxen, on the other hand, is commonly used for milder pain, such as headaches or menstrual cramps. Another difference between diclofenac and naproxen is their duration of action. Diclofenac has a relatively short half-life and needs to be taken multiple times a day to maintain its effect. Naproxen, on the other hand, has a longer half-life and can be taken less frequently. It is important to note that both diclofenac and naproxen have potential side effects and should be used with caution. Common side effects include gastrointestinal issues such as stomach ulcers or bleeding, as well as cardiovascular risks. It is always advisable to consult with a healthcare professional before starting any new medication. Here are a few examples to illustrate the differences between diclofenac and naproxen. Example 1. A patient with rheumatoid arthritis may be prescribed diclofenac to help relieve the severe pain and inflammation associated with the condition. Example 2. Someone who experiences occasional headaches or menstrual cramps may choose to take naproxen for relief, as it is effective for milder pain. In summary, while diclofenac and naproxen are both NSAIDs used to treat pain and inflammation, they differ in terms of chemical structure, potency, duration of action, and specific indications. It is always best to consult with a healthcare professional to determine which medication is most suitable for individual needs.